It's bleeding, it's burning all the time, like somebody sticking needles in me.
I know you feel desperate, but you shouldn't take other people's tablets.
He's 6. I feel like he's just a bit small for his age and he might have a weak immune system or he might be anemic or anything like that.
About a week after the operation, it bled again. It was 2 bucket loads of blood in the middle of the night.
The ability to offer more face-to-face appointments in the GP mobile surgery has been particularly useful for those patients who have just needed to be able to talk through some of their concerns. I never underestimate the effect of the things I say in a consultation. That is really important because patients often hang on to a simple set of words or phrases that you've used.
Most people want to tell their story and have a little bit of a chat. It's very important that our patients trust us. I love working with our patients.
Hi, is it Gazala?
Yes, it is.
Hi, come on through. I'm Dr. Harris.
How are you, Mr. Harris?
I'm all right, thank you. Come and have a sit down there.
We have seen each other before, haven't we? I don't think you remember me because you see that many people.
Yeah, I do remember your face, yeah.
I came with my husband.
Right, yeah.
He was like having a slight of a stroke, and I remember you helped us a lot with the hospital appointments and everything. And
Yeah,
you did
I remember
you sorted everything out for us.
Yeah, good. I breathe a sigh of relief when people remember them.
You are a very good doctor, so...
Yeah, all right, thank you. How can I help you today?
I'm having a lot of problems in my stomach.
Right.
It's the stomach lining. Now, I think I do suffer with gas as well.
Yeah.
But I think it's the curries that kind of trigger it off. Our curries are quite hot, you see.
Are yours, do you like them quite hot and spicy?
I do like them quite spicy, so yeah. I want you to know if I can have something that can just calm it down, because it's like a poking pain, like a needle pain.
OK. Is it more painful after you eat?
After I've eaten.
OK. Can I have a little feel of your tummy?
Yeah, that's it.
So if you just pop your jacket off and then come and have a lie on the bed. So if you just rest with your feet up, and if I can just get to your tummy, that's it. OK, and whereabouts? Point to whereabouts your pain.
It's about there.
So it's right at the top of the stomach, isn't it? Yeah.
Yeah, I can feel it there.
There.
Yeah.
There.
Yeah.
Just about there.
Yeah. It's like a circle around there. Thank you.
And come on, jump down.
Well, I don't know. I was thinking, is it that, or is it like gastritis pain, like they say? I don't know if it's that.
Yeah.
I don't know what it is, really.
Well, the fancy term for this is called dyspepsia, and dyspepsia just means really any discomfort at the top of your stomach.
Okay.
The most common cause for that is something related to the stomach lining, so excess acid, gastritis.
Yeah.
I think there's a component with you of a bit of acid reflux as well. We can settle it with some tablets, lansoprazole. They usually settle it really well because they shut down the acid supply to the stomach. So we'll give you some of those, but at the same time I want to do a little test of your stool.
Okay.
And that's to check if there's an infection in your stomach as well. Is that all right?
That's fine.
So if I arrange for you to collect a form and a bottle from reception...
Right.
To do that sample.
Yeah.
Is that OK?
That's
you
fine.
can do that any time.
That's fine.
And then I'll send the prescription to the chemist. Is that all right?
That's fine.
OK, great.
Thank you very much for your help today,
Nice
honestly.
to see you again. Yeah,
Thank
no
you.
problem.
I love coming to you, really, I'll be honest with you, because every time I've had a problem, you've always seeming to sort my problem out.
You're going to be like my best mate, you.
Yeah, we are best mates. That's why when they gave me the names, they were like, which doctor would you like to see? And I said, of course, I'd like to see the tall doctor.
Brilliant.
Anyway, nice seeing you today. Take care.
Lovely to see you, Gazelle.
Take care.
See you later.
Bye.
Bye-bye.
Thank you very much.
Thank you very much.
Bye-bye.
Bye.
Morning.
Morning.
Is it Jitka?
Yes.
Great. You're here for Debbie Harris today. If you just want to take a seat, she'll be out in a minute.
Thank you.
Jitka, come on, my love. Take a seat. I'm Debbie, you know me, don't you? Because you see me here with your children, don't you? You've been having a tough time, haven't you, Jitka? Yeah,
Well,
because I've known you a long time, haven't I? I've never seen you like this.
No, it's first time. I never have that pain.
No.
Before I have pain just sometimes back,
Yeah,
but not like this.
yeah. We've referred you to the specialist back
Yeah.
doctors.
Yeah. I'm waiting.
And when you'll get an appointment for that, and they, fingers crossed, will be able to have a look. Do you want to come to talk about your pain relief today, yeah?
Yeah, because when I've been here before, I don't know, it's like 2 months ago or 1 month. I've been for tablet, but it's no help.
Yeah.
And my cousin, she gave me a good tablet, just 2. So I think, but it helped me. It's very good.
What was it?
Oh,
Because I think I might know what you're going to say, but we wouldn't prescribe it, and you shouldn't really take it. Was it tramadol?
yeah.
Right.
Yeah.
So I am very, very sorry. I know you feel desperate, but you shouldn't take other people's tablets, really. And tramadol is not a tablet that we prescribe, and it is a very, very, very strong painkiller. And
Yeah,
it
but
is.
I take 2.
No, listen. You're going to see a specialist really soon. Who hopefully we're going to get to the bottom of exactly what's going on with you. It's a drug like, have you heard of like morphine and things like that, where people get tolerant to it and then get addicted to it, and it is very, very difficult to come off it. People might get tramadol if they've had an operation, they might have it for 3 or 4 days or something like that, but for chronic pain, it's no good, and I'm so sorry about that. Tramadol's an opiate medication. That's the same family as a drug such as morphine. Years ago, drugs like tramadol and codeine were prescribed a lot in general practice and in the hospitals because they are effective painkillers. We didn't know at the time that these medications would have lots of other effects on patients, such as tolerance and dependence. Stick to the amitriptyline. I'm going to give you more naproxen. I'll give you the top dose. If you take 8 paracetamol a day, 8.
8 paracetamol.
2 in the morning, 2 at dinner, 2 at tea, 2 at bed, and your naproxen, then you'll start to get good pain relief. I'm going to send you all that medication to the chemist. Listen, I know you're struggling, but do me a favour. Don't take any more tablets from your friend. I know Jitka, I know her well, so I can have a very frank discussion with her. People do pass medication around families, but that can be quite dangerous. We would always say to people, please don't do that. If we prescribe something and a patient has an allergy, then we can deal with it and document it. If somebody takes somebody else's medications, nobody knows what they've taken, and that can have dangerous consequences. Is that all right, my love? Keep going. Can you get up?
Thank you.
Oh, I'm so sorry to see you like this.
It's okay.
All right, my love. All the best.
Thank you.
See you later, love.
Bye.
Bye-bye.
You've got a nasty headache today, is that right?
I've got a bad migraine.
It's headaches, really.
Okay.
Mainly in my temple, behind the back of my eye, all situated here.
What do you actually mean by headache?
Well, it just feels really fuzzy all around here.
The pain went a bit higher up.
Yeah.
Up here, like an headache.
But it's normally just like here where I suffer from.
I still feel it in my eyeballs.
I can see you still struggling to look at me a little bit.
Yeah.
A few days ago, I was touching my head. I was having pain here.
I do have headaches, which is like I can feel it in there.
It's like a burning sensation, but also feels like really sharp stabbing.
I felt like from inside my head I was getting, like, tapped on the head.
And if the worst headache you've ever had is 10 out of 10, where would you say it is?
I'll probably say 8 or 9.
Oh, so it's bad.
Yeah.
Is it Mr. Shafqat?
Yep.
Hi. Come through.
Thank you.
Come in, please take a seat. Sorry, it's Dr. Eunice. I'm one of the GPs working here. You've called reception because you've been struggling with headaches, is that right?
Yeah, I've not had this pain since I was 16. I had this a few times. I've had some migraines, but they've not lasted
This long?
This long. It's been about a day or so. I've just stayed in my room.
Yeah.
And I can't get rid of them.
Okay, and it is just on one side, so you can.
It has gone. It's there, and I've had it a little bit there.
Any sort of, is it associated with nausea? Do you feel sick with it?
Don't feel sick.
Okay.
No.
Might sound like odd questions, but you haven't had any pins and needles going down your arm, any weakness down your arms or legs, any speech problems?
No, thankfully no.
Nothing like that. No. Okay. Have you recently had an eye test done and had?
I had one when I was in Pakistan just to get some new glasses.
Okay. Okay.
And he said it's more or less the region's the same. He checked my eyes; it was more or less the same. It's.
If you just bear with me, could I do your blood pressure?
Yeah.
Is that okay? If you just relax for me. That's fine.
I don't know what that really means.
So it's a bit high at the moment. What I'm going to do is wait a few minutes and we'll recheck it. Is that okay?
That's a very nice Spider-Man hat.
He's not got his outfit on. Normally he has full clobber top to bottom.
Full.
Yeah.
Nice.
Hi, Yusuf.
Hello, young man.
Okay.
Come on in.
Let's go.
Hiya, come on, have a seat. My name's Dr. Ferdinand. Pleased to meet you,
How are
babe.
you? Are you okay?
Your dad, I take it?
I am, yeah.
Excellent, great. What's going on?
So he's been ill now for the last 3-4 days, and I don't know if you'll see a lot of kids. He's got a bit of a cough now. He's 6, and I feel like he's just a bit small for his age, and he might have a weak immune system, or he might be anemic or anything like that.
Okay.
So I just wanted to make sure everything's...
Okay, well, tell me a little bit more about that. You say he's a bit small for his age. What?
Because I've got a daughter.
Yeah?
She's 2 years younger than him.
Yeah.
And she's about the same size.
About the same size.
That's my...
And you mentioned you're worried about his immune system.
That's because he's getting ill quite frequently compared to, like, I'm just comparing him to my daughter. That's the only other I can compare him to.
Yeah.
And she's okay.
All right.
But him, he's a bit...
Let's talk about this illness. How long? So 3 or 4 days he's had this?
Yeah, about Saturday night-ish it started.
Okay. And what started? What did you
Just
notice?
like feverish, hot and cold, and then just weak. Normally he's quite active, he's running around non-stop.
Okay.
And like he's just been laid out last 3-4 days, and he's got, obviously now the cough started as well.
How's the fever now? When did he last have a temperature?
To be honest, he had a bit of a temperature earlier.
Okay. Did you measure it, or did you just feel hot?
I grab my daughter, I feel her head, and then I'll feel his head. So I know they've been at home in the same time, in the same room, in the same temperature. So if she's cooler than him, then I'll know he's slightly warmer.
Fine.
Like, is that, I don't know how it works. Like, can you do like a blood test or something or anything?
Well, yeah, possibly. We'll have a think about that. I mean, certainly we need to figure out how big he is compared to what we think he should be.
That's it. You'll have probably a better idea because
we can work out if he's about the right size or not. There we go. Yeah. When was the last time you gave him any paracetamol or ibuprofen?
I got out back from work about 3 o'clock.
Right.
So he had it before that.
Before that. Right. His temperature's up at the moment.
By how much?
So it's 39.8, so it's pretty high. Young man, could you pop your coat off for me, please? All right, lift up this jumper for me. Thank you very much. Great. Right, give me an let's have a look in your throat. Chin up slightly. Stick your tongue out a bit. Has you been complaining with sore throat at all? The cough's the main thing, right. Shall we get you to stand on these weighing scales for me? Yeah, I'm just going to put them on the hard floor. There you go. You are 19 kilograms. That's fine. Can you also stand under here for me? Now I'm going to pop your hat off. There you go. Stand over here for me. We're going to see how tall you are. So there you go. That's it. Oh, pop your head up like that for me. There you go. You can feel something on top of your head. 15 centimetres, great. You can go sit back down with Dad. So at 19 kilograms, he's just below the 25th centile. If we took 100 kids his age, we'd have 75 of them who weigh more than him and 25 of them who weigh less, and they'd all be normal.
Right, spot on.
Similarly, if we took 100 kids his age, 50 of them would be taller than him, 50 would be shorter than him. He's about average on that. So we don't have any worries about his height or weight.
Wicked.
That brings us back to what's going on with him now.
Right.
So certainly everything that you've described very much sounds like an acute viral infection. Yeah, so that can cause a temperature for up to 5 days. His temperature's quite high at the moment. So if it's been more than 4 hours since the last dose of paracetamol, you can give him some more. And you can also give him some ibuprofen as well if you want, just to help get the temperature down. That'll help him feel a lot more comfortable. If he's getting worse, give us a call. If he still has a temperature come Friday, give us a call and we'll have another look at him. All right?
Go on. Right, stand up. Rip your jacket up, so thank you to the doctor.
Thank you.
No problem, man. Thanks for coming to see me.
Come on, let's go, son. See you later.
All right, it's okay, guys. Bye-bye.
So it's better than it was. It was 171 before. It's gone down to 161, but it's still higher. We want it under 140. So would you mind popping that jacket off? And it's probably better if you go up on that couch. Is that okay? Just sitting facing me. If that's okay, I'll pull this out for you. What I want you to do is follow my finger with both your eyes. Keep your head still, okay? And let me know if there's any double vision. So not blurriness. You might find some blurriness.
I've got double vision now.
Are you seeing two of my finger right now? Okay. I'm going to go up. Is it remain two all the way?
It's single until you get to that.
To the
in front of your face.
So all of that is single. It's just right centre here. It's double. Okay. Double vision can be an alarming feature for headaches and always requires further investigation. What we worry about as clinicians is headaches in general, if they cause weakness down one side of the body, any speech problems, any vision problems, or if they wake you up at night or you have early morning vomiting with them. It doesn't necessarily mean there's something underlying or dangerous going on, but it does need urgent attention. And we would look at other causes of headaches, such as stroke or tumours. There's a couple more questions I want to do, but they can be done whilst you're sat down facing me. Is that okay? This headache that you've been getting, has it ever woken you up from sleep?
No, it's not too bad. I mean, in the evening when I'm going to sleep, the dark room does subside a lot.
Okay. That fits more with sort of migraine, like I said, that dark room subsiding and stuff. Now, blood pressure itself can cause headaches, but the number that causes headaches is above 180, 190, that sort of thing, and yours weren't that high. I don't think that's what's causing it. I think it is a migraine, and we can give you a tablet specifically for migraine. So I'm going to give you that tablet. I'm not ignoring that double vision that you said. I now strongly ask you to go and see your opticians, because I want someone to do a pressure behind your eyes to make sure the back of your eyes looks okay. If there is something in your head that's causing double vision, it would cause you to have increased pressure. But there'll be other symptoms as well. So there'll be weakness down one side. There might be pins and needles. There might be speech issues. There might be facial drooping. None of that is what's happening to you. You know, your other neurological examination was normal. I can give you a call next week, but ideally I want you to do it as soon as you can.
Yeah, I'll try and get an appointment. I'll try again.
If you say to them, the doctor's asked because I've got a headache, I guarantee you they'll accommodate you, because they know what we're worried about and they'll know what they need to look. They need to check pressures. Any questions or anything for me?
No, not that I can think of, no.
Is that okay? No worries. I'll open that for you.
Thank you.
No worries. See you later.
See you. Bye. Thank you.
Hiya. Is it Mikhail?
Mikhail.
Okay. Hi. Come on in, Mikhail. I'm Dr. Harris. Come on through. If you just have a sit there, that'd be good. How are you?
Not the best. I started having tonsillitis every so often.
Yeah.
And then I had a referral. And I had my operation done. About a week after the operation, it bled again. And then I had to go back to the A&E.
Is it quite dramatic, that?
It was 2 bucket loads of blood in the middle of the night, and it wasn't. I just felt like lumps coming out.
And did they need to operate again, or did they manage to just keep an eye on it?
They just kept an eye on it, and they said that it would be okay.
Right. Okay.
So they didn't operate, and then it's been fine since. And then just recently, I felt like I had a headache and then a lump in the back of my throat.
Right.
And everything. I got seen last week, and they put me on antibiotics.
Right.
And they just said it was a bacterial infection, but it feels a lot worse than that. I have a really tickly cough now, which will come on. But when I cough, my chest tightens up and I get a sharp pain and it makes it hard to breathe. Also, in the middle of the night, my mouth will go dry
Right.
And my throat will bleed again.
Right.
At some points I feel like I'm coughing up phlegm, but it'll be a lump of dark blood.
So if you can open wide for me. Okay, say Okay. And I'll have a listen at your chest if I can. Just have a listen at the front. Deep breath. And again. Okay. Let's have a listen at the back. Deep breath. And out. Okay. I think you're certainly under the weather with a bug that's caused you to have this sore throat.
Yeah.
At the moment, you've no temperature, your chest sounds nice and clear. I can't see anything at the back of the throat that I'm overly worried about. It looks a little bit red, but it should settle itself down. I think there's an issue about if you have any more episodes of bringing blood up from that side.
Yeah.
What I might do is I might just give you a ring in a couple of weeks just to make sure it's settling. Because if you carry on bringing that area of blood in, it might be that we ask the ENT specialist to have another look at that side.
What do you think it's causing?
I think it's just a bit of an infection that's caused a bit of inflammation, and it's probably a raw area post-operation. Tonsillectomies are not very pleasant, and most people get over the operation and then never look back, but you seem to have just been a bit unlucky, haven't you?
Yeah.
But I'm optimistic it'll just calm down again.
Hopefully.
Okay.
Perfect.
Nice to see you.
Nice to see you. Take care.
All the best.
Yeah. Bye.
Hi. So I've got an idea why you're here, but I would like to hear the story from you.
It's my veins, so there's no circulation. The blood ain't getting through, so what it's doing, it's coming out on the legs. But this is what it's doing.
Okay, what's been happening?
It's bleeding. It's burning all the time.
Is
like
it?
somebody sticking needles into my leg.
Right.
I don't know what to do now.
Let's look into that.
Yeah.
And is there anything in particular you're worried about before we...
I asked last week at the chemist for some insulin for my diabetes. I'm still waiting for it. I've only half a tube left.
How come?
I don't know. They said they've ordered it and it hasn't turned up.
I will look into that. But before that, if you just stick your finger here for me to measure the level of your oxygen in your blood and your heart rate as well, okay? Okay, temperature's all right. Perfect. So it's 99%. I'm happy with that. Okay. All right. Are you okay to take your jacket off for me, please? Yeah, your coat. Yeah.
I'll just stop it down.
That's fine.
What, do you want to get to my back?
Yes, please. Just if you lift your jumper off, I should be all right. It's all right. All right. Take a deep breath. And out. And again. And again. That's fine. Okay. So I'm going to take a look here now.
Yeah.
Is that all right?
Don't pull it if you...
Yeah, I'll
it's low enough,
yeah,
start
don't worry
bleeding
about
again.
it. Just tell me if there's any pain, okay?
Yeah.
Was there any pus coming out of it?
I think they were just blood.
Just blood. But it stopped bleeding. And it just bled. You didn't you know, hit it with anything or anything like that.
It just started running down my leg.
Yeah. I'm just gonna take a swab out of it. Is that all right?
That's fine.
Yep.
Yeah.
I need to find you another dressing, so I'm gonna put this on, I'm going to give you another dressing. Is that okay?
Right.
Yep. Okay.
Thank you.
No problem at all. Right, so in terms of the wound, you've got a leg ulcer. It's something very common when you have diabetes.
Yeah.
You're taking a pain relief or a painkiller that works on the nerves. What I can do is increase the dose of that.
Yeah.
So the pins and needles and the burning sensation that you get is a neuropathic pain, meaning it's a pain due to a damage in the nerves.
Yes.
So we can work on this in terms of the pain. I will get you also a dressing just to change this.
Yeah.
And the insulin.
Oh,
so
yeah.
I'm going to speak to the chemist and see what happened.
Yeah. Right, thank you. I'll let her leave.
Yeah. I'll put this on.
Thank you.
No problem at all.
Right, thanks
Okay.
very much.
Do you want to wait outside? Is that
Right.
okay?
Yeah.
All right.
Wait here.
I'll go to the main building there and try and find some dressings to give you. Is that okay?
Thank
Yeah, no problem. Just need my...
It's nice when we're helping our own practice, isn't it?
Then you see familiar faces.
Hi there. Hiya. Is it Aisha? Come on. Oh, it's my friend. Oh, take a seat, my love.
Hi, afternoon. Is it
Hi.
Bernadette? I've seen you before, haven't I?
You have, yeah.
Recognise your face.
I thought I recognise that voice out there.
You all right, Chris? I'm all right, yeah, Rick, yeah. Hiya, Patricia.
Hi, darling. I'm Debbie. You might not remember me, but when you were a baby, I thought you were my own. I used to see you that much. Just a little boy who I've seen
Since birth, probably.
Since birth, yeah, I have.
Oh, wow.
How did you know my name?
Oh, I've been seeing you since you were a baby. I knew your mum when you were in there.
Yep.
You've lost nearly as much weight as me, Chris.
Have I?
Right, look at your face, that's all, you know what I mean?
So little Lucas, your mate.
Oh, I love him. We're all smart. And we're his hair long and curly or short. Sometimes he grows it
I
long.
just know everything about
Oh, God, I love him. Now then, is it Rohan?
Yes.
And Dad,
Hello,
hiya.
how are you doing?
Here
You all right?
come. Well, long time no see.
I know, very long time.
Oh, I recognise that name straight away. Take a seat, Rohan. Blooming heck, aren't you lovely? I think last time I saw you might have been 4.
Possibly. You've seen it before that as well, I think.
I used to see him all his
Yeah, you
life,
did, yeah.
didn't you? Right, well, it's lovely to see you. Come on then, tell me all about it.
So, there's been some issues with my skin and rashes have appeared on disarm. It's starting to spread like on disarm now and it really itches badly.
Does it?
And I don't know if it's been scratching, but it's like blotches in places.
Right.
And then on one of your legs, which leg is it? Is your left leg?
This leg.
It's got like, what I thought was a bruise.
We better have a look then, haven't we? Start off, take your coat off and we'll look at the ones at the top. Right, let's look. You're tall, aren't you, like your dad? Right, take your arms out. Where can you...
There's a few here.
These little things here?
Yeah.
Yeah.
And then...
And do you scratch it?
No, teachers told me to put a wet paper towel on it and...
When did she become a nurse? Teachers have very good advice. Right, so you've got her in there, yeah? Right.
And I think it's worse on this side as well. Yeah. Yeah.
There, there's a couple there. A couple of little things there. Isn't there? OK, let's look at your leg then. Right, yeah. That's there. Yeah.
It looks like a bruise, but it's
no,
not.
it's not. It definitely isn't a bruise. I'm
Okay.
happy that it isn't. Right, pull your pants up.
The other worry I also had was, because there's obviously a history of diabetes, when he didn't have his top on yesterday at home,
Yeah.
I had a look, and it looked like a bit dark around it.
What are you worried about? Show me.
Just there, if you look at that
That
darkness
little
there.
bit darker there, yeah.
Quite a bit.
Right, so what makes you that think about diabetes?
Just my wife's side, father-in-law,
Yeah.
and bruising to the skin, that kind of thing. Just a
Right,
thought,
yeah.
so I just thought, well, I may have mentioned it.
Right, so first of all, sit down then, there's a good lad. So diabetes in children is very different to diabetes in adults. Children present differently, they present poorly. So it's frequent infections, drinking like mad, weeing like mad, losing weight.
Okay.
Yeah, so I'm not worried about that at all, but I know you're a worrier and it is very easy. All I would need to do is put a stick in his wee, so you can drop us a urine
Yeah.
sample and I will do that. But don't worry
No,
about
no.
that. Is that all right? Right, the skin. I don't think this is anything serious. With Asian skin, when you get any minor skin thing, your pigment can change in your skin, so it's quite common. I think with this, there is a possibility this could have a bit of a fungal infection in it, which is dead common. People who are prone to eczema and dry skin, if you scratch, you can get a fungal infection, but they're not worrying. So you need to go right back to the beginning, incorporate into your daily routine when you're dealing with this, a full moisturise. Then I'm going to give you a tube of cream to put on all these little sore bits, and also you can put it where his skin's a bit darker there.
Yeah.
He might have a bit of a fungal infection there, and do that for 3 or 4 weeks. The more you moisturise, the less you'll itch. Is that okay?
Yep.
Lovely to see you.
Lovely seeing you too.
All the
Thank
best.
you very much.
See you later.
Bye-bye.
Bye-bye.
Right, Thomas?
That's
all what we've got. Do you want to come back there? We'll sort it out. So we haven't got the exact same dressing that you've got there.
No, that's all right. So we're into.
Do you think it's a bit smelly? Yeah. Is it always smelly?
Yes, I think it is, yeah.
How many days now has it been smelly for?
3, 4 times.
Okay, 3, 4 days now.
Yeah.
So I'm thinking now to give you antibiotics actually, because I couldn't smell it before, but now it is.
Yeah.
So should we prescribe some antibiotics for you?
Yes, sir.
Okay, I think so. I think we should. Okay? So it's going to be something called Fluclox, that's penicillin.
Yeah.
You're going to take this 4 times a day.
Yeah.
You're going to take it for a week time. If you're still not responding to the antibiotics and you're still having symptoms, or it's gone worse, then you will need to see us. Does that make sense?
That's fine, yeah.
Is that okay?
Yeah, thank you very much.
No problem at all.
It's been a pleasure meeting you.
Pleasure meeting you as well. You take care of yourself.
Yeah, bye.
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 Hi, is it Karen?
It is.
Hi, and you come. Take a seat there. I'm Debbie. I'm a nurse practitioner. Here, I'll take them off you. What can I do for you, my love?
Right, I've been waking up with these pains.
Right, okay. And when did they start?
About 2 weeks ago. I have problems getting to sleep. So once I'm asleep, I like to sleep.
You like to stay asleep as long as you can?
Yes. But at the moment, it's waking me up.
And is there anything that comes with it, or is it just the pain here?
Just the pain.
Right. And have you taken any painkillers?
I've taken some Panadol.
Right. Have you done anything? You know, sometimes you can strain yourself. Have you been doing anything different?
Not that I can think of. No.
You can't think of anything at all? You haven't been poorly?
I've been a bit down, but I've not... It's not been that... It's not really been too bad.
When you say you've been a bit down, do you ever get anxiety?
I used to suffer from anxiety, and I've spoken to 2 or 3 different counsellors.
Right.
So...
Are you feeling anxious at the moment? Or?
No.
No, you're not really. When this pain comes, is there anything else that's with it, or is it just a pain?
It's just the stabbing pain. It's like somebody's got a needle and they're sticking it
and
in.
it's quite a specific area.
Yeah, it's always in that one area, just there.
And you haven't had anything, not just now, but over the last few weeks, you haven't had anything change? You haven't had any sensations of fast heart rate?
I do suffer from quite quick heartbeats sometimes, but that happens when I'm really anxious more than anything.
And that's quite a common thing when you start to feel yourself panicking, your heart goes faster, your breathing goes faster and everything.
It happens more when I go into supermarkets now. My heart rate's over 100 beats a minute.
When you go into shopping centres?
When I go into shopping centres and supermarkets, my heart rate's over 100 beats. heart rate's over 100 beats, so it's close to.
Yeah. Obviously, you've got insight, you've had counselling, and that's something for you
and
to
I have
keep.
had medications
And
in
you've
the
had
past
medication, but you're not on any medications
No.
at the moment. So while you're keeping a lid on it and you're happy to continue, then that's fine. But you know, we're always here if you feel this is a little bit different.
Yeah.
Obviously, when anybody gets a pain in the chest, we think, could it be a heart pain?
Yes.
This doesn't sound like a heart pain because it's just one specific area.
Yes.
But it is a little bit unusual.
I've never had it before though.
Yeah.
And I have suffered from indigestion and
Yeah.
heartburn quite a lot.
Yeah.
And I take Tums for that.
Yeah. Have you always
And
had
then that's
indigestion?
Only over the last 4 or 5 years.
Have we ever tested you for H. pylori? It's a poo sample.
Right.
Oh, you have, look.
All right.
2012. You won't remember that.
Quite a while ago,
A long,
then.
long time ago. Some people, it can be the cause of heartburn.
Yes.
And we can test for it, and then if it's there, you can try to eradicate it with some antibiotics. We can do that. But just a couple of things I'm just going to do. Let me just check your blood pressure. It doesn't sound like this is anything related to your heart. Right, are you ready? We'll have to keep quiet now. So your blood pressure is up a little bit on there, but that's probably because you're in here.
Yeah.
Do you have a blood pressure machine at home?
I do, yes.
You do. So why don't you take it morning and night for a couple of weeks, write them on a piece of paper, put your name on it and drop it into reception, and then we'll take an average.
Brilliant.
Is that okay? You just come and sit on here. Right, I'm just going to have a little press. Any discomfort there? Uncomfortable, yeah. Does it change when we move your arms?
No, that's fine.
And this one?
That's a bit painful.
Right, lovely. You can come back down now. Right, so I feel confident this is not a heart problem.
Right, okay.
I think that you are tender right at the top of your stomach, which is epigastric, it's called, and that would fit with your indigestion and this. And people who often can go to A&E with chest pain, and it's actually epigastric pain from the stomach and a gastritis.
Right.
So I think what we'll do is we'll give you the kit to test for the H. pylori in your poo, and I'll also give you some lansoprazole.
Brilliant.
Okay?
Yeah.
I want you to carry on with the lansoprazole for a couple of weeks. Take paracetamol as well. If it's still there, I want you to come back and see us.
Yeah.
Is that okay?
Yeah, that's
Is there
fine.
anything else I can do for you, Karen? Is that all right?
No, that's everything's sorted.
Lovely to meet you.
Yeah, brilliant.
Okie dokie.
Thank you very much.
Okay, all right,
I'll see you later.
Do you think you could go and do a urine sample for me?
Yeah.
Shall we try and get this urine sample?
Yeah, of course.
Can you manage? Yeah.
Right, quick. Right, we need to go to the toilet now. You need to do a wee-wee. No, don't do a wee-wee now. We'll do it in here, quick.
If I can find a bottle. There we go.
Could you do a wee sample for me, please?
I shouldn't have gone just there, should I? I managed. It might not be enough.
Think you'd be able to do a little bit?
I think I'd probably do a little bit.
Cheers.
I didn't need that.
Your aim is good, is it?
Yeah.
Good man.
Oh, wow, that's a lot of urine you managed.
We don't enough. Yeah.
There we go. So there is enough. Well done.
Oh, brilliant.
Yeah, perfect. Lovely.
Hello. Hi, welcome to the mobile surgery. Is it Barbara?
It is, Barbara.
Excellent. You're here to see Dr. Harris today. If you'd like to take a seat, he won't be long.
Okay. It's the face I know then.
Hello.
Hiya.
Are you
Do
ready?
want to come in, Barbara? Yeah?
Come in.
Good afternoon.
Good afternoon to you.
You all right?
How are you?
I'm all right.
Good.
How are you doing?
Yeah, not bad.
Good. How can I help?
Well, I brought a urine sample in yesterday.
Yeah.
And found some blood in it.
Any urinary symptoms?
It's strong urine and a bit tingly.
Right,
Yeah.
right, okay. I noticed they've sent it off to look out for infection, haven't
Oh,
they?
have they? Right.
Yes.
Well, I brought another one today, didn't I?
All right, well, I'll dip that
Yeah.
one as well to just have a look at it. Urine-wise, no pains or anything?
No pains.
So we'll just have a little dip again, if that's okay.
That's fine.
I was looking back, and through COVID, I rang you up quite a few times, didn't I?
Yes, you did.
To try and sort of support your mood, really, wasn't it?
Yeah.
How's that doing?
No, I feel fine.
Yeah.
Keep myself busy all the time.
What do you like to do then?
Oh gosh. Well, I like to go out for lunch. You know, ladies have lunch. I have grandchildren. I like to spend time with grandchildren. I read. I do jigsaws. I knit.
Yeah.
I'm never still. I don't like to be still. I like to...
Because that was after you lost your husband, wasn't it?
It was, yeah.
Yeah, now you cope with that.
Yeah, well, everybody tells me I'm doing brilliantly,
Yeah,
so...
you appear to be. Yeah, you've done really well, haven't you?
Yeah, well, they wouldn't have wanted me to sit at home and...
No,
that's
I
for
knew
sure,
how old as well, didn't I?
Yeah.
Okay, so there's a trace of blood. So, if you have some blood in your urine, the important thing is to think about infection, obviously. So what we're doing is sending it off, and we're still waiting for the result.
Okay.
So we'll pick up on that next day or two.
Right.
Where we're interested beyond that is if you keep showing small bits of blood on the dipstick, but don't see any blood and have no symptoms. And occasionally that can be related to a little lesion in your bladder.
Right.
So it's important not to ignore it, and if you have repeated episodes of blood in your urine without an infection,
right,
then we refer you on for a camera test.
Okay.
And occasionally they'll just pick up one of these lesions in the bladder, and they can treat through the cystoscopy.
Yeah. Cauterise it or something.
Cauterise it, yeah. So that's the plan. Great, everything else
Lovely.
is good.
Thank you very much.
Nice to see
you. I haven't seen you for ages.
Exactly. Yeah, it's nice.
See a friendly face. That's what
exactly.
I said when she said it was you. I said, good.
Yeah, that's nice.
Thank
Cheers.
you very much.
Thank you very much.
All the
Barbara.
best.
Cheers. Take care.
I will do. You too.
See ya.
Bye now.
All right. Have a lovely day.
You too. Thank you.
Bye.
All the best.
Thanks for your help.
Bye-bye.
Bye.
Brilliant.
Thank you very
No
much.
problem. You take care of yourself. Thank you. Bye.
All right, that's fine. Great. All right, man. Nice to meet you. Nice to meet you as well.
Bye-bye. Thank you.
Keep up the good work.
Thank you.
One of the real benefits of general practice is when you can follow patients and support patients over many years. It is always nice to have patients thank you or appreciate the effort you're making.
We do become fond of certain patients. I've been lucky enough to work with families with their small babies who are now teenagers. Seeing how well the families do, seeing how brilliantly the children have grown and developed is really special.
I was thinking this morning, if I have to live like this, I want to die.
The question is whether you're going to get away with it without another operation, isn't it?
I'd even take my big toe off at the moment in time.
I just feel like I've hit rock bottom. It's just too much.